Okay, welcome everybody to today's webinar. This is going to be Enhancing Financial Wellness and Practice Success with BillFlash Pay. I am Peter Hawes. I will be the narrator behind the scenes today, walking you through this, and let's get started. So what are we going to be covering today? So the first thing that we'll be going over is patient satisfaction related to the payment process or the payment journey. And then we're going to get into using BillFlash Pay to streamline revenue collection. Then we will touch on online payment portals and patient engagement and the importance and impact that they have. And then we're going to talk about embracing the efficiency of electronic billing for faster payment cycles. And then we're going to go over a few of success stories that we've had of practices thriving with BillFlash Pay Services. So here we go. The landscape of healthcare payments is undergoing a profound transformation, as we all know, driven by evolving patient expectations, technological advancements, and shifts in the healthcare industry's dynamics. Complex, vague billing processes of old are no more enough for patients. Today, the focus is on creating a patient-centric, digitally driven, and streamlined payment experience that benefits both patients and healthcare providers. So what we'll do first is we're going to go over some key drivers in this changing landscape. And number one, as you see on the screen, is patient centricity. A key element getting noticed is patient-centric payment experiences, which aim to make healthcare payments clearer, easier, and more caring. In fact, 90% of patients say their loyalty relies on the patient financial experience. Now, that number is not up on the screen, that stat, so I want to say it one more time so it sinks in. 90% of patients say their loyalty relies on the patient financial experience. It's the last interaction with the provider, with the practice. And when we say loyalty, well, what does loyalty mean? Loyalty transforms into recurring visits, which obviously means recurring revenue. Patients now want transparency, simplicity, and convenience when it comes to managing their healthcare finances. Number two is digital transformation. Advancements in technology have caused the shift towards digital healthcare payments. Think mobile apps, online platforms, and electronic health records, or EHRs. They've changed how patients and healthcare providers connect. Number three takes us to value-based care. The transition from fee-for-service to value-based care models has incentivized healthcare providers to focus on patient outcomes rather than simply the volume of services provided. As a result, healthcare payments are increasingly tied to the quality and effectiveness of care, encouraging providers to adopt innovative payment models that reward positive patient outcomes. The caboose here is number four, price transparency. With patient responsibility now accounting for nearly 50% of healthcare costs, upfront pricing is more important than ever so patients can make informed decisions about their healthcare expenses. Price transparency initiatives are gaining momentum, and pre-visit billing is a great example how some practices now offer patients the option to pay before their appointment. This means patients are now better equipped to make informed decisions about their care and understand the financial implications. So just to go over those real quick: patient centricity, digital transformation, value-based care, price transparency. Now, redefining patient payment journeys is a crucial component of enhancing overall satisfaction for patients and ensuring the financial well-being of healthcare providers. So here are a few ways that you can redefine their journey. Number one, as you see on the screen, is transparent billing. So providing clear, itemized bills with explanations of charges ensures that patients understand what they're paying for. Pre-visit billing is another key step to informing patients by presenting what they owe before their appointment. Transparency builds trust. Trust transforms into loyalty. Loyalty into visits, and visits into revenue. Number two, convenient payment options. Offering a variety of payment methods, including online portals and mobile apps, gives patients flexibility and convenience. And number 3, as seen on the screen, automation and integration. Automating billing processes and integrating them with EHR systems reduces errors and administrative overhead. And let's face it, it just makes our job easier. So streamlining revenue collection is essential, not only for the financial health of our providers, but also for enhancing the patient experience and maintaining the overall stability of the healthcare system. BillFlash Pay offers solutions that deliver results to streamline your revenue collection. Number 1, online pay. Patients gain the convenience of settling bills, reviewing past statements, and checking balances effortlessly through our payment portal known as myproviderlink.com. I'm sure most of you have either been there or sent plenty of your patients to that site. 2 is Office Pay, tried and true. Elevate your payment acceptance process with our cutting-edge EMV terminals, which enable seamless transactions through swipe, chip, tap to pay, Apple Pay, Google Pay, whatever the preference of our patient is. Then you see Plan Pay and Auto Pay. Get paid more and faster with payment plans through Plan Pay and automatic payments through Auto Pay. Last on the screen is expanded gateway options. Now, our gateway seamlessly integrates with your existing merchant provider. Alternatively, you can take advantage of specially negotiated merchant account rates for enhanced cost efficiency if you go through us. Implementing online payment portals not only benefits healthcare providers financially, but also plays a pivotal role in enhancing the overall patient experience and engagement within the healthcare system. These portals are transforming the way healthcare organizations collect payments, making the process more convenient, efficient, and patient-centric. BillFlash offers online payment, so patients have the flexibility to pay online through the just barely aforementioned portal, myproviderlink.com. Before we move on from the screen, the note, 76% of patients want to pay their medical bills online. Yes, they still want a paper statement, but they want to pay the bill online. And you'll see the tip to make sure that we always inform our patients of any changes we've made to their payment methods. We want to avoid any confusion there. Confusion means delayed or abandoned payments. BillFlash Online, BillFlash Online Pay empowers practices to streamline the payment process for faster revenue collection. Patients benefit from the convenience of online payment options, ultimately enhancing the overall healthcare experience. But I want you to make sure that you heard faster revenue collection. Online pay features, you have guest pay for patients looking to make one-time payments, or you have sign-in pay for patients who want to store their preferred payment methods and view their billing history, which is obviously what the majority of us want ourselves as payers and patients. Online payment portals offer patients the convenience of paying their bills from anywhere at any time. As I've discussed, transparency is a cornerstone of effective patient engagement, and online payment portals excel in providing clear, detailed billing information. Patients can review statements, comprehend the costs of services, and track their payment history, fostering trust and reducing disputes, and they can do it from anywhere. Finally, online payment portals allow patients to set up automated payment plans, ensuring regular, on-time payments without the need for manual intervention. This feature reduces the burden of manual payment processing so that their patients can meet their financial obligations consistently and without stress. Up here on the screen, you see 80% of patients would consider switching providers for more convenience. And we know that the younger the demographic becomes, the higher that statistic climbs. Office Pay. With its user-friendly interface, staff can easily accept payments from patients, whether they're in person, over the phone, or mailed in, making it easy for patients to pay. Office Pay is designed to simplify billing and payment processing. Now, Retail Pay. For those of you that have been with us for a long time, if you missed the emails over the last few weeks, this could be new. Retail Pay allows patients to pay with cash or process payments without an associated bill. So it's a solution for streamlined in-office payments. With Retail Pay, practices gain a versatile tool that not only streamlines payment processing, but also enhances overall efficiency, contributing to a better payment experience for both staff and patients. Important on both sides. So to use Retail Pay, you simply go in and you will select, you'll click on the tab Get Paid, drop down to Pay Without Bill. Simple enough. And this will take you to the Retail Pay page where you can begin your transaction. Here, the Enter Payment Amount field will automatically be selected. So all you have to do is enter in the payment amount. That's it. So that's the only step. Now you do have the option to add an account number so the payment will be linked to the patient. But just want to make sure it's clear that the red asterisk there, the only one that is required is the enter payment amount. Now on your confirmation page, you can print or email a receipt, or you can choose to enter a new payment in the top right corner to start the process over again. So I just took a payment, one click, boom, I'm on to the next payment. Confusing billing processes can be a significant source of frustration for patients. Informing patients of their payment options up front makes the difference. In fact, 57.2% of patients prefer to be presented with the option to use a payment plan prior to or at the time of service. Payment plans such as BillFlash Pay can simplify revenue collection by providing an attainable option for patients who need alternative methods of payment. When you have efficient revenue collection, you can reduce the need for extensive administrative staff dedicating to billing and collection efforts. Right? That's the hope, that we get them to pay right away. So how can we do that? So using PlanPay is simple and user-friendly. So if you haven't done this before, I'm just going to walk you through this process as well. You start by selecting, once again, Get Paid up at the top tab, and then you're not going to navigate over to Manage Plan Pays. And you're going to click on that. And then you'll add the criteria for the payer you would like to create a payment plan for by searching by their name, account number, or form ID associated with their billing statement. Once you've done that, you find it, you'll click on their account or their name, and then you'll complete the details of the plan pay as shown here by adding any internal agreement notes. For example, payers agreed to this payment plan to take care of outstanding balance, and we are not charging interest for this payment plan. Recorded by Terry Smith, Office Manager. And then you will put in the monthly payment amount, the total number of payments that will be made to satisfy the outstanding balance. Obviously, don't want it to drag on forever. That is in your control. The date the monthly payment plan will begin. Confirming the payer's email address, choosing the practice's merchant location if there's multiple locations that exist, and then selecting the payment method, either card or check, and adding the necessary details. That simple, just fill it out, boom, 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 boom. After entering all necessary plan pay details, a pop-up box that looks just like this will appear prompting that the plan pay is pending authorization. Now there are 3 ways you can authorize the plan pay: by email, online, or paper. You see the different options up there. Prompts in the pop-up box will guide you through the necessary steps for each one of those authorization methods. Once the plan pay authorization has been completed, you will see the newly created plan pay appear in your list of active plan pays under Manage Plan Pays. Again, it was Get Paid, Manage Plan Pays. There's the list of ones that you have. Now, clicking into any of the active plan pays in your list will bring up the details of that plan pay, including scheduled payment dates, payments processed, and the remaining balance. To view a list of all payments made from Plan Pay payments, you may navigate to the Run Reports tab, which is just down from Get Paid. And then you're going to filter by all sub-accounts / all locations. And under the Payments tab, and you'll set the source to Plan Pay in the dropdown. So if you look at this from top down, Run Reports, all sub-accounts, all locations, plan pay. Now, auto pay. Automatic payments are a great resource for saving time and money. You can use BillFlash AutoPay to ensure you get paid on time and patients don't have to do anything beyond the initial setup. And a lot of our patients and payers love that feature. It's out of sight, out of mind. They want it taken care of. By setting up automatic payments, patients can avoid missing payments without the effort of paying every bill individually. They're also eliminating the risk of going to collections or taking on interest payments. You can even incentivize patients to use AutoPay with a small discount on their bills when they sign up, kind of like how some organizations will give you a small discount for cash. Just be sure to check with participating insurance carriers, as some may have language that prohibits discounts. Set it and leave it, AutoPay. Okay, so the future of payments are automatic, as 39% of consumers are paying their monthly bills with automatic payments. We pay our utilities that way. We make our car payments that way. We do our cell phones. Credit cards hit and miss. But our television, all sorts of things. This is how we set up our lives now. This means consumers are familiar and comfortable with putting their card on file to be charged each time a new bill is issued to them. This is nothing new. We do it every month. Pre-visit billing is the ultimate way to build transparency into your practice. All you need to do is send your patient a unique link with the pre-visit charge, which they can quickly pay online. Now, how do we reduce days to payment from the average of 20 down to 9? Well, electronic billing is a game changer when it comes to accelerating payment cycles in the healthcare industry. When combined with traditional paper-based billing, electronic billing expedites the entire process. In fact, when you combine BillFlash e-bill notices and mailed bills, days to payment can decrease from 20 just to 9. So if you're new to BillFlash, what I just said is the traditional paper statement, and you tie it together with e-bill notices, which are texts and emails. When you combine those three, then that's how we're reducing the average payment cycle time from 20 down to 9, and it also increases overall collections by almost 20%. This efficiency minimizes the chances of errors, reduces administrative overhead, and limits the need to send patients to collections, which is the ultimate goal. Healthcare administrative workers are feeling the burden of staffing shortages. All of us are. So it's important to prioritize solutions such as electronic billing. Consequently, electronic billing not only improves cash flow, but also enhances the overall financial health of healthcare organizations, making it a crucial tool in today's fast-paced healthcare landscape. You can place your trust in BillFlash, backed by a strong track record of over 2 decades of serving more than 30,000 practices. Our solutions produce results, as you can see with Dottie from Prestige Medical Billing. Within just the first 30 days, Dottie experienced an astounding 60% increase in payments. Let's focus on that. If you're looking at the screen, there's the title down. We're in paragraph 2, a 60% increase in payments, an outcome that epitomizes the results we are constantly striving to achieve. Rochelle here has been using BillFlash for over 15 years and has benefited from the cost-effective nature of our solutions. We had small practices in mind when we designed BillFlash, so creating products that get practices paid more and faster was top of mind. And BillFlash Pay is just one of the many services in the comprehensive suite of BillFlash solutions focused on getting you paid. So I just want to say thank you for joining us today. I hope you learned something. You can schedule a demo today at BillFlash.com, whether you are new to BillFlash and you want to review the different products and services offered, or if some of the things we talked about for you savvy BillFlash users seemed new, like retail pay, you can also set up a demo. If you're familiar with BillFlash, it'll be quick. Maybe demo is a word that scares you away, but think of it as a 5 to 10 minute conversation if we just need to go over some of the processes and how we can more efficiently use BillFlash so that we can get paid more. So once again, I'll just say thank you so much and have a fantastic day.